Hey, Mount Vernon, this is Mayor Shawyn Patterson Howard. I know I initially said that we were going to postpone today's update, but there are a lot of things that are going on with Mount Vernon Hospital, and I didn't want to delay this update. I wanted to share with you information and as close to real time as possible. So this is going to be a short live. This is not going to be an hour. We don't have any guests on tonight, but I am going to give you some updates concerning Mount Vernon Hospital that are very, very critical, especially in light of what we are dealing with COVID. I'm going to ask that if you please just take a quick moment and share this live. I've got my iPad. I'm getting ready to share it. And if you have questions, then please also put your questions in the chat box. So I'm going to share mine, and if you could take a moment to share this to your page and start a watch party, I'd appreciate it. Okay, so happy July 4th weekend to those who celebrate, and for those who don't, happy Juneteenth all over again. So we are here tonight because Mount Vernon Hospital, which is something that we have been speaking about ever since October when it was released publicly that they were going to close, is an issue that is becoming more and more critical now than ever before. And so we need to continue to give you updates and let you know what is happening. As we heard in October, Mount Vernon Hospital said that they are closing the hospital and that they were opening an ambulatory care center on Sanford Boulevard with a freestanding emergency room. Now, this came to light after Montefiore produced a report that said Mount Vernon is a medically underserved community. Mount Vernon Hospital has housed in the past few years a mental health unit, which we know we need here in Mount Vernon inpatient, a substance abuse unit. They have an AIDS designated care center, a freestanding clinic for infectious disease. And Mount Vernon, that has been a challenge in our community for a long time. They've had an incredible cardiology program there. Mount Vernon Hospital was a burn unit and provided, top-level burn care for many years. Right now, it has a dialysis center. We also have an inpatient unit that the New York State Division of Corrections uses that brings in over $20 million in revenue to Mount Vernon Hospital, and it provides critical care to those who are in corrections facilities throughout the state. They're brought down and they're served there. And we provide a lot of services to our senior population, to our veterans, and to so many people who do use the hospital. I know there's been great debate as to the fact that there are a lot of people in Mount Vernon who do not use the hospital. We've heard concerns that care has declined over the years, and I would agree that the level of care has declined, not because of the staffing, but because of the constant cuts and decreases in resources that are being provided to the hospital and the hospital staff. So they're trying to do miraculous work as well, it was Sound Shore then, and now Montefiore continues to cut their resources. So one of the things that we're looking at right now, we've stopped all constructions on the Sanford Boulevard property, so there's no construction that is happening at that site right now. But what is happening at Mount Vernon Hospital is that they continue to cut services. And so last week on June 30th ended their medical internist program. And this was a program for people who were finishing their medical residency, their residence program. They were providing residence services at Mount Vernon Hospital. They ended that program. That is a big revenue generating program. And those doctors also provided lots of care to our residents through Mount Vernon Hospital. They took out and they removed what you call the intensivist. The intensivist is the person who oversees the intensive care unit. So right now, Mount Vernon Hospital no longer has an intensive care unit, and they have closed the 4th floor. That is critical information that people need to know, because as we continue to talk about COVID, we talk about the ICU unit and the need for ICU beds. Mount Vernon Hospital, as of now, has removed their intensive care physician and placed them over at Sound Shore Hospital in New Rochelle, and Mount Vernon does not have an intensive care unit. One of the other things that we've been challenged with over the past few months is that they have taken out med-surg, which are medical surgery beds, but also some of their critical care staff that is in the emergency room. And so when you take out critical care doctors and nurses in the emergency room, then when we have someone who goes to Mount Vernon Hospital in an ambulance, they may not have the level of staff that can provide the correct level of services to someone in case of an emergency. And one of the things that they've done repeatedly over the past few months also is they reroute ambulances over to New Rochelle Hospital or to Monty Moses in the Bronx because they have not properly staffed the emergency room. So our physicians and our nurses are continuing to see cuts and reductions in services and resources being provided to them so that they can provide high quality care. Now, this is all but criminal, especially in a time of COVID. While Mount Vernon and New York is experiencing, a flattening of the curve right now when it comes to COVID, we know that it only takes one or two outbreaks to really reduce that. And without an ICU, with them continuing to reduce the number of beds, with there not being a medical intern program there, they're killing the hospital by 1,000 cuts. And we know that COVID has impacted urban communities, densely populated communities, and communities of color in a way that is disproportionate to any other communities that are affected. We know that you see higher rates of mortality in persons of color, in persons who are poor, and in persons who have comorbidities like high blood pressure, diabetes, heart disease, kidney disease, asthma, COPD, and obesity, which as a medically underserved community, Montefiore identified that those are some of the top medical challenges facing our community. And so when you have a community that is riddled with bad health, and then you have a pandemic that is still crushing our country, just because we're seeing spikes down south right now does not mean that we're not going to see spikes in this community again. As much as we are working very hard around social distancing and wearing masks and opening our community safely, there, at any moment we can see an uptick in cases, and we're not going to have a medical facility to take care of us. So let's dig just a little bit deeper. New Rochelle Hospital, Mount Vernon Hospital closed their labor and delivery unit many years ago, 20 years ago now, and New Rochelle Sound Shore Hospital took over those functions. Right now, Sound Shore Hospital is not delivering babies. They've closed their labor and delivery unit. They say it's for COVID. They say it's temporary, but we're just really not sure if that's temporary. As part of the Montefiore medical system, babies are now being born over at St. John's Riverside Hospital in Yonkers. And so Mount Vernon doesn't have a labor and delivery ward. New Rochelle right now does not have a labor and delivery ward. And so babies are going to be born over in St. John's or maybe even White Plains Hospital. How many more services are we going to see a decline in? New Rochelle's ER waiting times are increasing. Lawrence Hospital's ER waiting times are increasing. White Plains Hospital's ER waiting times are increasing. And we know that Montefiore Moses campus in the Bronx, which is their main campus, has the second busiest emergency room in the country, only behind Los Angeles County ER. So Montefiore Hospital in the Bronx, they have hundreds of staff vacancies in their nursing divisions. They're having a hard time taking care of Bronx residents. And I can promise you that any New York City and especially Bronx elected official will tell you, that Montefiore, while a good hospital, is definitely overwhelmed. And they don't want to see Mount Vernon Hospital close because Montefiore in the Bronx cannot absorb Mount Vernon residents. Montefiore in New Rochelle cannot absorb Mount Vernon residents. Montefiore in St. John's and Yonkers cannot absorb Montefiore residents. So as much as they say that they have a big hospital system and that they're able to absorb the residents of Mount Vernon, that's just not true. They continue to say that we don't use the hospital and there's a decline in residents' use of the hospital. Many don't use the hospital, but many do use the hospital. But it's almost like a chess and checkers game. As they continue to move services out, they redirect our residents to other hospitals. And so if you can't get dialysis in Mount Vernon anymore, you have to go to one of their other facilities. If there's not an intensive care unit in Mount Vernon, then you have to go to another facility. If they don't have internists and medical residents there, then you have to go to another facility. I've been getting calls from private medical practitioners who practice throughout Mount Vernon and usually have admitting privileges, meaning when they see a person in their practice and they need to admit them to Mount Vernon Hospital, then they admit them there. But now Mount Vernon Hospital is telling them that if they admit their patients to Mount Vernon Hospital, then they have to just allow staff doctors, staff physicians within the hospital to take care of their residents, that they cannot come into the hospital and take care of their own clients, their own patients, and that if they want to provide services to their patients while they're inpatient, then they would have to send them over to Montefiore, New Rochelle, or Montefiore in the Bronx. Once again, this is a systemic, calculated pushing of services outside of our community and making it more difficult. You can create any statistic that you want to create by moving services around. And so it's almost like a three-card Monte game. Well, yeah, really a three-card Monte game. Montefiore Hospital is playing three-card Monte right now with the health of Mount Vernon residents, and they're shifting and moving services everywhere, but yet continue to say that it's our fault that we don't use the hospital. And so you're blaming the victim. We're talking about systemic racism in this country right now. We're talking about the fact that poor communities and communities of color who are suffering with high rates of disease are not provided the same level of services that wealthier communities and more diverse communities are receiving. And so this is systemic racism playing out, plain and simple. I'm not one who tries to pull the race card, but this, you're not seeing this behavior. Montefiore is investing in communities that are much more diverse than ours, but they're not investing in our community. Yes, you can say that you're investing $45 million in the Sanford Boulevard location, but that's not Montefiore's money. That is money that they receive through the state of New York, that Mount Vernon and everyone else pays taxes for. So it's not a financial risk at all to Montefiore Hospital. And so they can't say that they're taking a risk by providing services in an outpatient facility with an emergency room on Sanford Boulevard. The investment is being made by the state of New York taxpayers through a grant through the state of New York. And not only are they not taking a risk, they're also taking our certificate of need away from us. And I need people to really understand this. That's why I'm just taking my time tonight. Montefiore owns what they call a certificate of need. A certificate of need is kind of the operating license that you need to operate a hospital in a community. So right now, Monty owns the papers and has exclusive rights to operate a full-service hospital in the city of Mount Vernon. This is something that they have put in with the state of New York to transfer the certificate of need used to operate a hospital in Mount Vernon, and now give the certificate of need to Montefiore Sound Shore in New Rochelle. And the site that they're looking to open on Sanford Boulevard will come Sound Shore Hospital at Mount Vernon outpatient treatment facility. And so that certificate of need will be transferred over to Sound Shore Hospital in New Rochelle. Now, what does that mean? That means that if we wanted to approach NYU, Presbyterian, Northwell Hospital, or any other medical care system to bring a hospital to Mount Vernon. We could not, because Montefiore is taking and applying to the state of New York to take the certificate of need outside of Mount Vernon. Now, how can you take a certificate of need outside of our community and give it to another hospital, preventing us as a community from being able to recruit any other hospitals to come into our community to replace them? They do not want competition. This is a shell game. It is a 3-card Monte game. It is not about providing medical services to the city of Mount Vernon and our residents. It is about continuing to grow their very large, very powerful, and very politically connected hospital system at the expense of Mount Vernon residents. The $45 million that they received from the state of New York to build this new facility on Sanford Boulevard, the only reason that they received this money is because of the high rates of disease in our community and the high levels of poverty. And so how are we going to continue to allow money that is earmarked to serve our community to leave our community and have no control over whether or not we are properly served? So what we need to do, so, this is a call to action. We've been speaking about this for a while. We've been asking people to join the Save Mount Vernon Coalition. We know that people are hesitant because they say, well, we don't like the hospital, we don't like the quality of services at the hospital, and we don't want to see Mount Vernon Hospital continue to stay open. But we're not just forfeiting Mount Vernon Hospital. If we don't save this hospital and push to keep our certificate of need in our community, then we are forfeiting the right to have any hospital in the city of Mount Vernon. So please, we're going to put this information in the links, but I'm going to share it with you right now. We need you to contact our state elected officials, Senator Alessandra Biaggi, Senator Jamal T. Bailey, Assemblymember James Gary Pretlow, State Senator Andrea Stewart Cousins, and our Governor Andrew Cuomo, who has led the fight around COVID, and I would really believe should support Mount Vernon in making sure that we have a hospital. During this COVID uptick, he demanded that medical facilities expand their capacity to serve communities that are hardest hit. Mount Vernon is one of the hardest hit communities impacted by COVID in the state of New York, based on our size and our population. So again, to take a hospital out of our community at this time is criminal, and we cannot just sit idly by and watch that happen. So we're going to put here in the links information about how to contact our different senators, assembly people, and our governor. We also ask that you reach out and continue to send information as well to our county executive and our county legislators, Lyndon Williams and David Tubiolo, as well as our city council. Mount Vernon, politics in Mount Vernon is crazy. And oftentimes elected officials in Mount Vernon are quite divided and on different sides of the table when it comes to many issues. But I can tell you, this is one issue that we are all on the same side of the table. We all understand the gravity of losing a full-service hospital in Mount Vernon. We all are very clear about the fact that we are a medically underserved community. We are all very clear that over the past 20 years that our hospital has been raped over and over and over and over again. Services decreased and transferred, and we've served as a feeder hospital for Sound Shore, and we continue to serve as a feeder hospital for Sound Shore, and we just cannot continue to sit by idly and watch this continue to happen. And so again, reach out to our Senator Alessandra Biaggi, our Senator Jamal T. Bailey, our Senator Andrea Stewart Cousins, our Assemblyman J. Gary Pretlow, our Assembly Majority Leader Carl Heastie. So Malcolm, if you could also get that information and put it in there, because we want to make sure that we're reaching out to both of our leaders in the Senate and the Assembly. If we can put Legislator Lyndon Williams and David Tubiolo's information in there, as well as our city council members, we have to come together. We have to unify ourselves, and we have to speak up. Also, the Save and Transform, because it's Save and Transform, Mount Vernon Hospital Coalition is looking for residents to participate in video interviews and testimonials during the week of July 7th through the 10th, this week. So we're looking for people to participate in video interviews and testimonials. And if you're interested in participating, then please send an email to savemvh@gmail.com, savemvh@gmail.com. And in your email, please put in the following information: your first and last name, if you've been a patient at Mount Vernon Hospital, and if yes, please include the approximate month and year where you were served. If you are a Mount Vernon resident, if you were born at Mount Vernon Hospital, we want to make sure that we are collecting stories and testimonies on how important it is for us to have a hospital. We're not just fighting for the hospital to remain open, we're also fighting for the services and the resources that are provided this hospital to be upgraded. Mount Vernon, we are at 2,718 cases of COVID. And while we are only seeing about 2 new infections on average a day, we know that that can change at any time. We know that pools are open. We know that parks are going to be reopening. We know that restaurants are opening. We know that people are having parties and gatherings and not always social distancing. We've seen upticks all throughout the country. We want to manage any uptick we see here, but we don't have a magic wand. We don't control how people move and operate all day long. And so all we can do is try and make sure that we are ready and that we're prepared to deal with any uptick in our COVID cases. And we need to make sure that we have a full service hospital as our partner to do this. They're already taking equipment and resources out of the hospital and transforming it and transferring it over to Sound Shore and to their other facilities. So, and I'm also saying to residents of New Rochelle and Yonkers and White Plains who might be listening, if you sit back idly and let this happen to Mount Vernon Hospital, woe be unto your community when Montefiore decides that New Rochelle is no longer a resource or an asset and that you're a deficit, or when St. Joseph's Hospital in New Rochelle, which has struggled for years, and I know that because I'm a former board member, what if they decide they're going to close that? What if they decide to go for St. John's Riverside? Look, if you sit back idly and you ignore what's happening to Mount Vernon, please know that your community can be next. That's pretty much it. I don't have much more to say. Yes, we do need this hospital with better staff in it and specialty doctors. We need to make sure that the services that our community needs most are restored to the hospital. We need to make sure that the nurses and doctors who are working hard, who are working overtime, who are making bricks without straw, who are working miracles without updated medical equipment and imaging equipment and diagnostic equipment and materials, that they are receiving the support that they need. These are not doctors and nurses are professionals, and people who I speak to tell me that they receive really good care, but the challenge is that they don't always have the resources. All of us work in different places where we understand sometimes that the resources are not available, and how frustrating it is to work in an environment where you do not have a lot of resources. So we have to make sure that we are fighting for the resources that Mount Vernon Monty needs. Let me just check for a second. I don't know if I have a message here. Give me a second, guys. I'm doing some of this on my own tonight. And I just want to make sure that I have answering any questions. Yes, we want to save and transform Mount Vernon Hospital, Belinda, and keep them from pulling out. We need your voice. And Peggy is saying, please call out to our elected officials and let them know we need a full service hospital. Absolutely. Montefiore is so big in the Bronx, and it's so sad to have a hospital, not to have a hospital in Mount Vernon where it's needed. Yes. And Erica, this is extremely serious, and those residents who use Mount Vernon Hospital will definitely suffer. Mount Vernon, we have almost 100,000 residents here. 30% of our residents are seniors, and our seniors need a place to be able to go. We have a lot of residents who have low income, and their families have a difficult time going to visit them in other places. And so we need to make sure that their families have access to them. We also have doctors who, if they are admitting their patients to Mount Vernon Hospital, need to be able to go in there and serve them. I know if I'm being treated by my doctor and I have to be admitted into a hospital, I want my doctor to be able to come and serve me when I'm inpatient, and I shouldn't have to go to another place so that my doctor could have access to me, especially if they have admitting privileges. So please, everyone, pay attention to the comments in the comment section, because that is where we are putting information and links for you to reach out to all of our elected officials in the region. We need your voices. We need your support. We need you to lift your voice and help us. If this hospital pulls out, we want to be able to say that we gave everything. We want to say that we fought and we left it all on the field, not that we just sat there and watched more resources be taken out of our community as we pointed a finger at each other. So Mount Vernon, please take care. Please be safe. Please be well. Please continue to remember that we are in the midst of a pandemic. I know we all have quarantine fatigue. I know so many of us are tired of not being able to enjoy our friends and families in the way that we've traditionally done. I know that many people miss church, miss going out to restaurants, miss hanging out with friends and family, and just having the social activities. I know a lot of people have lost their jobs and you're struggling with income. We have a lot of families who are worrying that the courts are going to reopen in a few weeks and that eviction actions are going to take place, and they're worried about the stability of their housing. Please know that here in the city of Mount Vernon, we have received several $millions from HUD that we will be using to focus heavily on eviction prevention, and then also supporting people who need help with their what do you call it? Their utilities like Con Ed and phone and things of that nature. We will be working with our courts and with our legal services of the Hudson Valley and Cluster and some of the other not-for-profit agencies who will be located in the courts to provide support, assistance, and referrals to families who are impacted. But while we know that there are many families who are still hungry. We're still seeing the food lines. We still know that there are people whose income has been reduced and they're hungry. We know that there are parents who are returning back to work, and because camps are not open traditionally, whether it's through the city or through private means, that's putting a lot of parents in a bind. We know we are living and we're dealing in a time that we've never seen before, and it's not about me being a first-time mayor and being in office for 6 months. Mayors who've been in office for a full term, 2 terms, 3 terms, we are all struggling with the same issues. We know that people are tired and you don't have many social outlets. And so we're seeing a lot of extra behaviors that are happening in the community, whether it's people shooting off fireworks, whether it's people having extra barbecues or their own self-proclaimed block parties with DJs. We're asking, while you might be frustrated and while you might be depressed or overwhelmed and tired of staying at home, we still need to work together as a community. We still need to respect our neighbors. And if you're having a gathering and you have people that you're invited to your home then you only want to entertain the people who are at your home and in your yard, and your neighbors 2, 3, 4, 5 houses away should not be overwhelmed by your music. They should not be overwhelmed by all of these double parked cars, nor should they be overwhelmed by people parking in their driveways or hanging in their driveways and hanging up and down the streets. Our neighborhoods are not the club. We are sorry that the clubs are closed, but that is something that is outside of our control. And so trust me, if you have money to have have a party, then trust me, I hope you have money to start paying some fines that we will be levying against you. We're not trying to be hard and we're not trying to be nasty, but we do have to maintain a sense of order and decency and respect in our community. No one is targeting you, but the rule of law still has to be in effect. And so we're asking people to be respectful of your neighbors. And if you're not respectful of your neighbors, and we have to send police out, or if we have to send ordinance officers and code enforcement officers out, we will be writing tickets, and we will be writing stiff and hefty tickets, because if you just have such disregard for this community and disregard for your neighbors, then we're not here to worry about your finances. We have to establish and reestablish order in our communities, and that is something that we will be doing. So Mount Vernon, thank you again. Please reach out to your elected officials, and also reach out to the Save and Transform Mount Vernon Hospital Coalition if you have a testimonial that you would like to share around COVID. So someone asked a question about Engel. Engel, while he is a federal elected, he has been very active since October. So definitely you can reach out to Elliot Engel as well. I would also encourage you to reach out to Schumer and Gillibrand. While they are federal electeds, we need their voice to be involved. They have the ability to influence and have communication with the governor and our state division and Department of Health to let them know that Mount Vernon needs a hospital. Jamal Bowman, I recently started having conversations with him. He's in the process of running. He has been one who's been in the lead for the Congress seat for Congressional District 16. So he has not been elected to office yesterday, but he is joining the conversation that we're having. So we need everyone on board, and you can even contact our county executive, because as health goes in Mount Vernon, it will also impact the rest of the county. So no one really should get a pass when it comes to speaking up and lifting their voices and taking a stance on whether or not they support the continued opening and transformation of our hospital, or whether they're going to sit idly on the side and allow our hospital to close. And so I think that's where we are. Jamie Pesson asks, have the conditions of the purchase of the hospital been violated? If yes, how do we get our hospital back and under a different hospital network? Jamie, the only way that we can get our hospital back is by getting the state to prevent Montefiore Hospital from obtaining a certificate of need to close the hospital in our community and transfer our certificate of need and operation over to Sound Shore. If the state allows them to do that, then we lose our hospital. It doesn't matter what violations and what conditions were violated. If this certificate of need is transferred to Sound Shore, then there is not an organization that will have a license to operate a hospital here in the city of Mount Vernon. And so, we know that Monty brought the hospital from Sound Shore. Monty made promises that they were going to make certain amount of investments into the hospital. We have not seen all of those investments made into the hospital. And they said that they've put a lot of time, energy, and they've lost money. And that's why they have to close it and move to a different operating model. This is not a conversation that can continue during this season, especially as we are dealing with a pandemic at the level that no one has ever seen before in this country. And so I'm going to close this up right now. Let's hit up Mr. $13 million man, Dr. Oswa. He is the CEO. Yes, so the electeds do have a meeting along with NISNA, with Dr. Oswa, who is the CEO of Montefiore, on July 13th. So we do have a meeting with him. But look, this is the bottom line. Monty is already continuing to close and take out more and more and more resources. And so between now and the 13th, even though that might only be a week away, we can see even more resources taken out. In the last week, we've already seen that they've taken and shut down the intensive care unit, that they have stopped visiting and care privileges of doctors who admit patients to Mount Vernon Montefiore Hospital, and that the corrections unit is being transferred out to another hospital, as well as the medical residence program is gone, and they've started taking different hardware and tools and resources out of the hospital. So each day they are taking aggressive and bold action to close down the hospital. So by the time we can get to Dr. Oswald on the 13th, and by the time we get there, they can say, well, there's just really nothing left. So we're asking that people reach out now. We have a meeting with him, but we are not waiting for that meeting to continue to fight against this. We need your support now. Thank you, Mount Vernon. Everyone have a blessed evening. Continue to take care. We're not here to politicize this information, this battle. The health of our community is far too important for political battles and for personality battles. We must unify. We must work together. The people united and our community united cannot be defeated. But if you can divide us, then you can conquer us. So anyone who's speaking in a way that is divisive, I would really encourage you to look at them with very, very careful eyes, because we do not have time to be divided over whether or not we need a hospital. We have been consistent. Our calls for the saving of Mount Vernon and the transforming of Mount Vernon Hospital have been consistent from day one, and it stays consistent now, and we will continue to do everything within our power to keep our hospital open, and not only keep the hospital open, but ensure that as we stabilize the hospital, that we are putting new investments in the hospital, we're adding services back into the hospital, and that we're providing the level of comprehensive care and quality care that the residents of Mount Vernon not only need, but we deserve. God bless Mount Vernon, and take care. Thank you. We will continue to put information for our electeds in the comments. Have a great evening. God bless.